Hello, Dr. Dan here from Steinway Family Dental Center. We get a lot of questions about tooth pain, so today we're going to answer some of the most common questions that we get. And the first question is, how can I stop the tooth pain fast? And I know there's different suggestions that people have, like you can use scotch, you can use garlic, this, that. In reality, the fastest way to stop pain is to see your dentist, and he can stop it. Anything else would take much longer and would not be as effective. The next question we have, what is the longest lasting solution for tooth pain? And again, of course, the longest lasting solution would be to see your dentist and have the problem fixed. And that would be the longest lasting solution. The next question is, what is the most common reasons for tooth pain and how can the dentist help me to get relief from the pain? So the most common one, of course, is decay, right? When there's a decay that goes all the way into the center of the tooth where the nerve hides, the nerve is getting exposed and insulted by the bacteria that is present in the mouth, then, of course, you get a lot of pain, right? You can also be sensitive to different temperature, hot and cold. It can wake you up at night. And it could be fixed, but you would need to see the dentist for that. The next question is, what are some most common reasons for non-dental tooth pain? Some people are grinding their teeth. Usually they do it when they sleep. And then in the morning they come back and they have a toothache, right? Or the jaw ache. And that is not related to decay. It's just simply because they applied too much pressure. And they can get relief, but the dental professional would be able to help you and get you a device to help it, or maybe get you some medicine and some massages, or eliminate the problem altogether. The next question is, why I'd be experienced constant dull toothache? Well, again, usually it would be because your alignment is off and then you're biting incorrectly on your teeth, and that would lead for you to bruxism, or like bite really hard on your teeth, and you can break your teeth because of that, and you can get a lot of pain, right? So you can get a relief from that by seeing your dentist and seeing what exactly is the problem. Because based on the problem that you have, the solution will be used, right? Next question, what can I do about extreme or unbearable tooth pain? And I would suggest, if you can, of course, and let's assume you cannot get to any dental professional, I would brush and floss and rinse your mouth with the warm water. If you can, use some salt in it, on a cup of warm water, half a teaspoon of salt, mix it good, and then rinse with that. And see if that's going to help you to relieve some of the pain. It's not going to get rid of the pain completely. You do need some medication, most likely actually somebody helping you and doing something for you with that. But if you have the medication, I would take some ibuprofen and mix it up with some Tylenol. Let's say 600 to 800 milligrams of ibuprofen with 500 milligrams of Tylenol, and take it all with coffee or with a drink that has caffeine in it. The next question is it normal to experience some tooth pain after dental procedures? You could be uncomfortable, but pain, I think something is not correct, and maybe you would need a little bit more help. I would go back to the dentist and have him check. The next question is, what can be done if I'm experiencing dental pain next to a bridge, implant, or a tooth? And the answer is, you can really get it clean. So don't baby it, even if it hurts more or even if it's bleeding, right? So you want to brush it more, not less. Because if you brush it more, there's a chance that it will go away. If you brush it less, there's no way it's going to stop hurting you, right? So get your toothbrush, get your floss it really well, brush your teeth well, and rinse it with warm water and salt, and you should be okay. The next question is, what can I do at home to alleviate tooth pain? And again, like I said before, what you can do is you can rinse with warm water and salt, but the first thing you should do is you should really get it clean. Because something is insulting the nerve in your tooth, and that's most likely because the nerve is exposed or the nerve has some bacteria insulting it. So you would want to brush your teeth well, and because you can't really touch the nerve, you would rinse with the salt water. Of course, if something is obstructing the access to the nerve, you want to remove that. If there is any food getting stuck in the hole that you have in the tooth, and that gives you pain, rinse it out. Try to clean the hole out, right? But don't stick anything into it because you can actually get into more pain because you touch something you're not supposed to touch. The next question is, can a dentist find me a permanent solution to tooth pain? And the answer is absolutely yes. The only person that can fix your teeth for you is the dentist. So, of course, go see your favorite dentist, and if you can't find anybody, then just give me a call and I'll help you out. The next question is, how soon can I schedule an appointment to treat tooth pain? And here at Steinway Family Dental Center, we keep special slots open for people who are in pain. And we have some slots in the morning and some in the afternoon. So if you call now, most likely I can see you today before the day is over. If you, let's say, call by the very end of the day, then the first thing in the morning, I'll be able to see you and help you out. I hope we've been able to answer some of your questions. And if you have similar questions that we didn't answer today, then give us a call and come in and let's evaluate you and see what exactly is bothering you. This way we can help you best. So you can call us here at 718-728-3314 or find us online on alldentalneeds.com and request an appointment.